Hospital, Princess Margaret Hospital, Mount Sinai, and Women's College Hospital.
He has completed his undergraduate degree in human biology and medical radiation sciences at the University of Toronto. His medical school and residency were at McMaster University. Dr. Gopee-Ramanan is a strong advocate of balancing work, his mental and physical health, always finding new ways to grow. He follows the principle of change of work is rest. Before directing your attention over to Dr. Gopee-Ramanan, we have some housekeeping rules for those in attendance. This is to ensure that everything runs smoothly, ensuring the optimal experience for everyone present here today. It would be greatly appreciated if you can all remain muted at all times to block out any extra noise that may be in your background unless you are asked to unmute at any point.
If you have any questions, please put them in the chat and we will address them in the Q&A session at the end of the presentation. Alternatively, you may use the raise hand feature during the Q&A session and we will call on you to turn on your microphone. The session is going to be recorded, and so if you want to keep your camera off for any reason, you can. And if you get kicked out of the session, please feel free to click the link again and you'll be added back to the session. And without further ado, we'd like to introduce Dr. Gopee-Ramanan.
Thank you, Vijay. Thank you, Simrit. It's an absolute pleasure to be here. Thank you for the invitation and putting this together. I think what Elevate Careers is doing is wonderful, particularly because you're providing a service that's free for people at a time where a lot of us have questions about what the next steps are going to be in our lives. And that's not unique to the young crowd. It's equally applicable to many of us working. And so thanks for doing all that. And thanks for a warm introduction. Please feel free to call me Prasa. That's the short form, Prasaanthan, for any of you who want to pronounce it. I have a jam-packed session today, so I'm hoping that I can take all of your time, respect it and the value of it, and leave you with some thoughts for the long run. So part of the talk is going to deal with overarching topics from my experiences, and some of the talk is also going to deal with some very specific contents for the concept of applications to medical school. There have been so many mentors and people that have paved the way for me, and so I can't stand in front of you today if it weren't for those people, and I hope to pay forward what I've learned through their experiences and their guidance, and that's why I'm always willing to answer any questions. I'll let the gentleman here moderate the session, but feel free to post it in the chat or raise your hand. And I'm looking forward to a productive hour or so, okay? So we're gonna start off with some fun stuff to begin. So I'm gonna launch my presentation and share my screen. So first I will share the screen. We'll make sure everyone can see everything. Give me one sec here. Excellent. Can you see my presentation?
Yes.
Excellent. So I'm going to hit play, and the first slide is blank. So that is fine. Now, if at any point it gets stuck or things don't work out, just let me know, and we'll go from there. I'm going to set my timer for the first part of the talk. So there's going to be 3 parts of this talk. The first part is going to be about 20 minutes, and the second part about 20 minutes, 25 minutes, and then the final part about another 20 minutes. So I'm just going to set my timer so that I stay on time. Okay. So I advise anyone who doesn't have this app, or if you want to use the website version of it, that's completely fine. I'm going to be doing some polling later on, and I really fully encourage your participation. I'm looking forward to hearing your thoughts and ideas. We want to make this interactive, and this is for you. So all this information has gotten me to where I am today, but this is really your time. So please make use of my presence here in any way that you see fit, and please do participate. I'll leave this up for a second. So it's pollev.com/ my full first name. I apologize for the spelling and giving you a lot to type. G751. I refuse to pay for the whole thing, and that's why I'm keeping it free, and it gives me a 751 at the end. I'll put this up again when it's relevant. So we're going to start with some cases. So I'm a diagnostic radiologist. I get to see inside people, and I get to do so without having to cut anyone open. So what you see on the left here, if I move my cursor and show you, this is a CT scan of the chest, abdomen, and pelvis. This is in a patient that I'd like you to tell me what happened to them. Of course, I'm not expecting you to read this study, but I just want to highlight some interesting stuff. Now, I'm going to give you a clue. The image on the right is a 3D reconstruction of the images from the CT scan on the left. So could somebody just take a stab, open your mic up, and yell out loud, what is the most abnormal thing you see in this person? And it can be very vague. I don't expect you to know any anatomy or medicine here. Anyone? Okay, no worries. I don't want to put anyone on the spot. So we're going to show you some interesting things here, okay? So I'm going to pause this here, and I'm going to pause this fella here. Can everyone see the images? And just let me know if you can't, okay? On the right-hand side, we've got the 3D reconstruction. So if I move it along, this is the person's thorax. This is the rib cage. This is the sternum. And you've got the spine behind all of that. You've got the shoulder blades, which are called the scapulae. And you see a little part of the proximal arm, which is the humeral head. So these are the humeral heads. At the bottom here, you've got the person's pelvis. Now, the pelvis is composed of multiple different bones. So the pelvis itself has an iliac bone, a pubic bone, and an ischium on both sides. As you can see, symmetry is our friend. So if you look at this pelvis, you don't need a medical degree to tell me that this one looks fragmented on the patient's left. So that's on our right, but on the patient's left. Very fragmented, what we call a comminuted iliac bone fracture with multiple differently angled fracture fragments with some displacement. Displacement means you cut a piece of cake and you actually pull it out, it's displaced from the rest of the body of the cake. So that is a left iliac pelvic fracture. There are additional fractures here that you can't really see too well on this single 3D reconstruction. So if somebody has a pelvic fracture, what kind of mechanism are we thinking? Was this person, I don't know, especially a severe fracture like this, were they playing soccer and they got hit? Were they walking around, they fell down and they broke their pelvis so badly? Actually, no, that's not the case. So this person is unfortunately a victim of a car crash. So let's see, can you see that? Yeah, so 50-year-old male comes in with a motor vehicle collision, the total car was destroyed. So to be honest, the fact that we don't see worse fractures is probably a good thing. I'm gonna take that back before we come to this case. I'm just gonna take a moment here and pause this video, and I'm gonna drag it around. So if you look at the case itself, that's just the bones, right? We have a lot of internal organs that are taking some damage here. So some of you might actually be able to, with some anatomy knowledge from university, put some of these pieces together. So what divides the thorax from the abdomen is the diaphragm. And this diaphragm has a big gaping hole here. And that hole is allowing a whole bunch of stuff from the abdominal cavity to travel up into the left hemithorax, the left half of the thorax. It's a very severe case where nearly the entire thorax on the left is occupied by stuff from the abdominal cavity. So that includes stomach, that includes omentum, that includes small bowel loops. And if you look at the loss of symmetry here, on the right, we have a normal lung. The normal lung looks black on CT, okay? So all in all, and we can see how bad this fracture is. Now, when you have a fracture so bad, unfortunately, the surrounding muscles also get affected. So there's a large muscular hematoma on this left side. The gluteal musculature is involved. The iliacus muscle is involved. So I just wanted to give you a taste of what it's like to be a radiologist, particularly at the trauma scanner. In Hamilton General, where we trained at the trauma site, we'd have to read these as they flew off the scanner. So basically you're at the scanner, you're surrounded by the surgeons and the trauma team, and you're telling them exactly what's wrong as the patient is being scanned. So within the span of about a minute and a half, you've relayed all these findings, and then you go back to your workstation, you look hard for bleeds and tiny findings that are only a few millimeters. Let's go to the next case. This is just to warm you up and give you a little bit of enthusiasm for the field. So I'll tell you what we're looking at. We're looking at a CT of the head of a person on the left side of the screen. And then we're looking at what we call a 3D reconstruction of the cerebral vasculature. So these are the blood vessels inside the brain, okay? Now there's a lot going on here. So we're not gonna look at the 3D right now. We're gonna look at the CT. I'm gonna give you a couple extra cases later on. But what I wanna point out is white stuff on a CT head, not so good. Okay, so this is brain. I can't call it normal because there's a lot going on here. This is a very bad case of disease going on in this patient. I'm going to guide you through a few things, okay? So the ventricles, we're going to see later with a normal CT scan, they should not be this big. These are the ventricles. This is where the CSF is housed within the brain, within the head. All of this white stuff is blood. So this blood is pooling into the entire ventricular system. So this is the kind of image that if you open at the scanner and you're looking at this, you immediately call neurosurgery and say, this person needs immediate neurosurgical intervention. So you drop what you're doing, you run, get the phone, you call the neurosurgeon. Now what they've done is they've actually put in this thing here. So follow this fellow, this little white thing that's going in and out, okay, as I scroll. That is called an extraventricular drain. So they've put in a drain to try to suck this blood out, because if they don't, this person is going to have so much pressure inside the brain because it's compartmentalized and it's full of bones that don't flex, that they're going to start to herniate, which is their brain is going to come down into their cervical spine, and that's not going to be a good outcome. So that could lead to death. Now, why was this even the case? Why do they have this blood? Well, when we look at the vasculature, I'm going to pause this guy here. I'm going to take you right to where the vasculature is here. Now, again, symmetry is our friend, ladies and gentlemen. So this little bilobed little hangy thingy, which looks like a little grape, is an aneurysm. An aneurysm is an abnormal opening and dilatation of the blood vessel wall, which is supposed to be tubular, that causes the blood to rush in. Now, when blood rushes in, and especially in your brain, the blood pressure is pretty high, it causes constant force on the wall, and the wall then breaks down and ruptures, causing this bleed. And this bleed has to be controlled. So this is a neurosurgical, but also a neurointerventional emergency. So this leads us to what they did after for this patient. So this person was 58 years old, she was female, and she suddenly collapsed. And this is the kind of way in which bleeds acutely present, acutely meaning right away, chronically meaning over time. So this is an actual angiogram, not a CT angiogram, but an actual angiogram where they've gone in, put in some contrast, and there's a lot going on, ladies and gentlemen, but I'm going to point out this little guy here that looks like the grape we saw earlier, and it's got this fuzzy little stuff going on, right? That's what we call an endocoil. So this is endovascular coiling of the anterior communicating artery aneurysm that we saw. And this was done by neurointerventional radiology through a little tiny prick in the groin to access the femoral artery. So that's how they save this person's life. They don't open up the brain, they actually do it all through the blood vessels. And if it's done well, within a couple of days, if they recover well, this person probably took much longer because of the degree of bleeding. And they put in about 6 coils, if you look up here. This person could technically, if it was a tiny aneurysm treated well, walk away. And the most popular person we know that had 2 of these treated is Daenerys, Khaleesi from the Game of Thrones series. Okay, so that was actually somebody who survived 2 aneurysmal brain bleeds. Okay, so we're warmed up. We're going to go right into the content. So my name is Prasa. We've been introduced, and I'd like to talk initially for the first few minutes about many roads to an MD, one goal. So the goal is to become a physician. If that's your goal and you're considering that among other healthcare professions, there are multiple different ways to get there. And everyone takes a very colorful road. I'm gonna share with you my colorful road and some lessons that hopefully you can apply to your lives. This is Ustad Zakir Hussain. Some of you probably know him. He has said, don't try to be a master, just be a student and you will do fine. And he says his father told him that. And it's a very beautiful way of thinking. So you don't have to try and be the master. None of us will actually ever attain that state of perfection. What we have to do is be better today than we were yesterday. And that's part of this talk. So how long does it take to become a doctor? The first couple of years are spent in university undergraduate studies, then a whole bunch of years in medical school, 3 to 4 in Canada. Then you have 2 to 5 years of residency training where you are a physician, you have your MD, you are a doctor, but you're training in a subspecialty. And then finally, you finish off your training with fellowship. So that's what I'm currently doing. It's subspecialty training. And then if you look at the CBME model, so by the time any of you get into medicine, the model is actually really going to be competency-based. What that means is the new approach they're doing. Where's my mouse? Can you see my mouse? Okay, you may not be able to see my mouse. On the right hand of the screen, we have an infographic. It's less about the time. It's not about a set amount of time. It's more about, are you meeting the competencies as you go through the way? So can you put an IV in, very early on? Can you diagnose a heart attack? Can you perform a surgery to take the gallbladder out? And you're slowly building these skill sets, among other things, to allow you to then fully be licensed and go out and be independent. So where did my awakening happen? I started undergraduate studies in 2005, but my awakening, my start of this whole process of focused, I got to get this done, was January 22nd, 2009. Myself and 2 other buddies of mine attended a conference not dissimilar to this one, although it was in person. We traveled from UofT every single night for 3 days in a row to London, Ontario for a pre-med conference. And when we did that, we were inspired by the way some people said they took interesting, colorful routes to get to medicine. So we finally decided, okay, enough is enough. Let's stop doubting ourselves. Let's just go for it. We know what needs to be done. We have to hunker down, get through the MCAT, get through the application process, get through the interviews, and get it. Why are we short selling ourselves? So once that sort of rebirth happened consciously, we were able to take our very directed steps. I'm happy to say that all 3 of us are now on the other side. One is an internal medicine specialist, now subspecializing in cardiology, myself in radiology, subspecializing in women's imaging, and my other friend who's a family physician and he wears multiple hats. So he does surgical assist, he's a coroner, and it's just nice to see that our plan, because we worked hard at it, was born to fruition. What are the fellowships in my realm? So the fellowships are, once you become a diagnostic radiologist, most people do complete a fellowship. I would say about 95% of the people in the last 10 years have done a fellowship. And fellowships break down the information you need to know into multiple subsections. So these are abdominal, breast, cardiothoracic, et cetera, Mine's women's imaging. So what it does is it actually takes breast and abdominal body imaging and puts it together. And I also do a little bit of obstetrics. So it's a good fellowship for me, but somebody else might choose emergency and trauma. Somebody else might take musculoskeletal. It's entirely up to your interest area and what you want to do with your career. How many years did it take? Well, I started undergrad in 2005. So I completed high school, UofT St. George, UofT Michener. Again, I told you I took a more colorful route. So the 3 years that I spent in the MedRad Sci program were 3 years that maybe somebody else might not have needed to do or avoided. But in my case, it allowed me to choose radiology. And so in hindsight, and I believe this is the case for me always, nothing happens without a good reason. So I always look at life as if there's a lesson to be learned and all things happen for a very, very good reason. At the end of this journey, I'll be 16 years out from high school, and it's a lot to process. So today we're going to talk about some things that keep your backpack that you carry with you of skills and coping mechanisms nice and strong and full so that you can last the whole journey. It's a very long marathon. It's not a sprint. So my first lesson, you have to plan, prepare, and execute. How do you approach that? So you need to know what the requirements are for all of these 6 different medical schools. You cannot be wishy-washy about this stuff. I had this stuff memorized when I was going through the process, and this was even years before I got in. I knew exactly what the backpack colors were. I lived and breathed what I wanted to get into. And as you think, so you are. The food you eat is who you are. So these are the things that you have to focus on and not obsess over, but be aware of. You should be able to rhyme these things off. In my multiple mini interview for McMaster University, where I ended up doing medical school, they actually asked me, what are the current changes we've made to the application process? And I thought, I'm the applicant. Why are you asking me this question? But this was an actual station as part of the interview. And because I knew this stuff down to a granular detail, I fed exactly back to them the answer. If you look at this chart, I had studied the chart like this at my time, all the way up to the class that I entered. So it was class of 2012. This one is a class of 2020. And if you look, there's a whole smattering of GPAs. There's a whole smattering of MCAT scores. So don't sell yourself short. You have to try to optimize every level. But say one level is holding you back. Let's say MCAT verbal reasoning. Well, look at the CAR score of 123 to 125. That's on the lowest end of the spectrum. 4 people for the class of 2020 that are graduated this year had a score of 123 to 125. How many people had a GPA of 3.0 to 3.49? 6 people. Imagine if they thought, oh, I'm not good enough, I'm not going to apply. Well, they would have lost out on the opportunity. You have to believe in yourself because nobody else is going to believe in you. Be like water, go with the flow. And this is an important statement. I learned this through multiple times in which I got stuck, I got worried, and I got anxious. Bruce Lee has said, empty your mind, be formless, be shapeless. What does that mean? You have to adjust yourself to the circumstances. Maybe this time around, this didn't work out. Navigate that problem and restructure your plan. Be resilient. Be like a rubber band that bounces back to its original shape. And it's really important to build a skill set that'll allow you to do this. This does not happen overnight. So if you feel like you're somebody who needs to build that skill set, you need to find your structure. Hopefully this will give you some structure to bring that into effect over the next couple of years as you go through this process. Lesson number 3, don't be a one-trick pony. What does that mean? Try to diversify your investment portfolio in yourself. You have to build skill sets that cross boundaries. I'll give you my example. So I like to do many different things. I was part of a spiritual organization that gave me a ton of opportunities to lead projects, to talk to people, interface. Some of the projects off the top of my head, homeless shelters in downtown Toronto with which we worked on different projects that were longitudinal across multiple years. I've worked with the CNIB on setting up info sessions. I've worked with the city of Mississauga to do some of the projects that our center was leading. And so what I'm trying to get at is build a community of people that will support you, work with you, and help you become a leader. Other things I enjoy, the tabla, obviously I put out there, Ustad Zakir Hussain. I'm an amateur, so don't consider me in any way a professional player, but I love it. And it is an escape mechanism for me. So I listen to music and I play music and I enjoy music with my family. I got to play a part in multiple different things. That's my wife and I at Disneyland. And so you have to diversify your interests. And that's my dog Simba. Lesson 4, fail, fall, and fly. So what does that mean? There's not going to be a scenario in which you just set your sights on something and you achieve it. Now, that can happen. I'm not saying it can't, but it is not the common thing. Most of us have to fail multiple times before we actually get the whole lesson to be learned. These are some quotations from Thomas Edison, from Michael Jordan. Michael Jordan actually failed over and over again, and that is why he says he succeeded. So it's really important that you don't give up after the first time you fail at anything in life. You have to give it a full shot, and you have to analyze, why is it that this particular attempt didn't work out? You must grow in spirituality, and I think that is a part and parcel of today's COVID-19 era. No longer can you rely on outside influences to keep you happy. You have to look inwards and build your happiness so that it lasts you your entire life. If you keep looking outwards at just the things you do and the things and the people you spend time with, that is not enough. You must be able to hold yourself high and take the road less traveled so that you are self-confident and self-contained in many ways. So how does that play into role here? So that's my first 20-minute timer. I'm going to stop it for a sec. We'll get through this, no worries. This is an example of what is called a super specialty hospital in a rural part of India that actually 50 years ago didn't even have proper plumbing or electricity. But here we are, we're looking at some massive world-class facilities that provide high-level quaternary care to people for entirely free of cost. And I think that's a wonderful way to sort of inspire yourself. Find your inspirational points, whether it's people, organizations, mentors, and build your pattern of thoughts after the highest ways of thinking, not the lowest ways. Lesson number 6, take risks and fall in love. This is an important one. So this is my wife. We got married in 2015. That was our engagement shoot with my family. We decided to do some handing out of some stuff for the homeless in Toronto at Allen Gardens. And because we had done it a bunch of times together, we decided to make that the point at which I proposed to her. And that's our son a few years ago. His name is Anand. And that is us going into this year. So this is my family, and I love spending time with my family. So you need to have strong family supports. And it's really important to put work-life balance at the highest end of your planning process. So you have to have work, you have to have family, friends, and self, but that self component should drive the rest of it, so that the self is then able to give of itself to the rest of your family and friends. Lesson number 7, you have to do what you love. You've heard this many thousand times. I'm not the first person to say it. I happened to fall in love with radiology because I had my medical radiation sciences. If I went back, I was doubting myself at the time, saying, why do I need this? Why couldn't I just get through it? Why couldn't I get in from third year of undergrad? Well, look at me now. I love what I do, and I have an extra set of skills that makes me highly marketable. And I appreciate life for giving me those opportunities. So this is a funny comic. You probably might have seen it if you've looked into it before. It's a radiologist's day. It starts, in the morning at bedtime, looking at your phone, checking your messages. At breakfast, you're checking the caseload. At work, you're dictating. At lunch, you're eating. Then you get frustrated because the work never ends. And then at break time, you're drinking this coffee, and you're tired at the end of the day, 6 p.m., 7 p.m. You're driving home, you're eating dinner, and then you're checking your emails. So although that's the case, I love what I do. So on the top left, that's somebody looking at cases, putting everything together to help a patient out. In the middle, this is a book that I wrote chapters for because my mentor on the right, that is Dr. Athreya, he works at Niagara Health Sciences now. He was an interventional radiologist that opened the door for me and mentored me to allow me to do things that I never thought possible. Book chapters, I would have never seen it coming. Lesson number 8, look within, introspect. You have to stop every single day. I do it every single day. And I had a slide about disclaimers. I will not speak about anything in this talk that I don't do myself. So I think it's really important you build a brand where you're authentic to yourself. You have to look within and you have to introspect. How was yesterday? How is today? How will tomorrow be? What can I do better? And we'll get into this a little bit later in the talk. And then finally, you should know the CanMeds roles, because when you go into an interview scenario, you should be able to talk about these different things. So the CanMeds roles are what make up the training scheme of a medical professional, particularly an MD. So the medical expert is at the center. That is the most important thing. That is what you are training to be when you become a physician. But around it, you have a bunch of skills that you have to build. These include professional, communicator, collaborator, leader, health advocate, and scholar. And if you look at this diagram, it just scratches the surface. But if you Google it, CanMeds roles, before your interview, you should read through some documentation and figure out what it is that you can talk about in each realm that you've done before you apply to medicine that'll help you continue to build these things. Finally, life is a game played. This was not said by me. This was said by one of my mentors and teachers. Life is a game played. So it's okay to lose every now and then, and it's okay to pick yourself up, dust off yourself, and move to the next level. So we're going to take a quick 1-minute break. Let me check the chat box. Are we doing okay, gentlemen?
Yeah, we're doing good.
Yes. So
Excellent.
far,
Let's take a breather.
no questions yet.
Wonderful. Just gonna check here. If anyone has any questions, now is a good time. Chat box. Good stuff. Okay, very, very good. Okay, I'm gonna go right back into it. My screen's still shared, I think.
Yeah, it is.
Yes.
Excellent, excellent. Close the chat box before I go back.
And anyone who's interested to participate in the poll, we put the link in the chat, so you can use that.
Perfect. Well, thanks for doing that. Okay, hopefully you had a minute to process some of what I said. I just want to get some good material to you guys. I know it's a lot and I know it's fast paced. Now, we're going to go into a couple of cases again. I'm going to show you why. I'm going to teach you a little bit. So let's take a look at this. Now, this is a CT of a person's brain. It's just one slice. Now, obviously, when you do a CT, it's done so that you look at it transverse. So what we're actually looking at is, imagine the person on the screen that you're looking at sitting with their nose up, their head inside the screen, and their feet towards you. So you're looking from the bottom up. That is convention. That's how you look at a CT. When we look at this, it is just one slice. So we're just seeing the person at about this level, okay, at about the temporal bone. What you're seeing are the ventricles. Do you remember the earlier case where there was a huge interventricular bleed? Well, here we don't see the blood. Here, this is normal. So this is a normal head, and it's got normal ventricles. It's not pushed to one side. There's symmetry. You look at it and you say, maybe it looks like a frowny face. That is approximately a normal head. The brain volume is normal. The brain matter is normal. And as you can tell, there's not a lot of specific white areas to suggest bleed or calcification. So this is a normal CT. Now, we talked about bleed, so why don't we build on that theme? This is an epidural hematoma. So bleeds come in different forms. I'm just going to teach you a couple of points about some of the most common type of bleeds. This kind of a bleed is what happens when you get a baseball bat to the side of your head. We see this quite a bit in Hamilton, unfortunately. It's known to be some sort of sketch areas of violence, unfortunately. And if you come out of a bar brawl or something like that, this is what happens if you get hit in a particular place called the temporal bone, through which a very specific artery is going. That artery is called the middle meningeal artery. And this middle meningeal artery bleeds a lot. And when it bleeds and it pushes on the brain, it is epidural, meaning it is outside the dura, which is the covering of the brain. And because it's pushing, this is a surgical emergency. You pick up the phone, you call the neurosurgeon. What else is it doing? It's pushing on the right ventricle. So the left side of our screen is the right side of the patient. It's pushing on the right ventricle, it's completely occluding it. The left ventricle is getting larger, particularly on the bottom part of it, right? Which is what we call the posterior side. And it's getting larger because it's getting trapped, because there's no way for it to counteract the blood that's pooling. So this is a bad scenario. You call neurosurgery right away. This is an example of a different kind of bleed. See how it layers kind of more crescentic, more lenticular, not lenticular, more crescentic. So it looks like a half moon. And this kind of a bleed actually has two colors in it. Well, it's not colors, it's grayscale. I love grayscale. So the bottom part of it is brighter than the top part of it. And there's a flat level that you see. That flat level is a fluid level. Why is it there? Because there are two areas of different ages of blood. The blood at the top, which is towards the nose, which is top of the screen, that part of the blood is actually less acute. So it's a little bit older and it's going through some metabolism and is changing into a different set of molecules, so it appears different. The bottom part is more acute, and the acute stuff layers down. So this is called an acute on chronic subdural hematoma. And then this one is a good one. This one actually has two kinds of bleeds on it. So one, the middle structure that splits your brain in half in terms of fascia is actually called the falx, F-A-L-X. And it has a little bit of hemorrhage around it in the part closer to the front of the brain, which is what the white stuff is. Then you also see a little bit of white stuff on the patient's left, so the right side of the screen. And that area of bleed is called a subarachnoid hemorrhage. It is much closer to the brain than the other two hemorrhages that we talked about. So this actually has two kinds of hemorrhages on it, just for a little bit of trivia and learning. Okay, so those of you here are definitely going to be facing the MMIs in Casper at some point in your application process. The multiple mini interviews in Casper are very important things that you have to prepare for. So I'd like to get a couple of points to you, but I just want to show you my dog again because he's cute and I like him. And there he is sleeping. Okay, so we're going to look at a few different things. So Casper, we're going to look at the format and logistics, and I'm going to give you a couple of specific tips. MMI, we're going to look at the format and logistics. I'm going to give you a few specific tips. And then we're going to talk just generally, and I'll take some questions at the end of this middle session before we go to the final session. So I want to talk a little bit about what is in your control. Now, you are all here because you value the information that you're going to get from this talk, and I hope to respect that. You're also here because you are motivated to apply for some kind of healthcare profession, whether it be medicine or otherwise. You have to sit down and have a serious conversation with yourself. What is in your control? What can you do that does not depend on the luck of the process, the type of exams out there, whether or not you were sick on the day that you wrote the MCAT or not. How do you make the most of what is under your control? So I call it the 3 Ps, okay? Preparation, perseverance, and proficiency. So we're going to talk a little bit about each one. Preparation means you have to do your research. We talked about this earlier. If you have 6 medical schools in Ontario and you want to get into medical school in Ontario, you need to know the details of the admissions criteria by heart. The other thing you need to know is, what are the MMI and Casper? And you don't have to pay a lot of money to find this stuff out. Just go online, Google search, look at viewpoints, take a bunch of information. More you have, the better, so that you're not biased by 1 or 2 different sources. Take all the free information, put it together, and create a little folder for yourself and build your knowledge area. If you want to take the MMI and do it well, if you want to take the Casper exam and do it well, you have to prepare and you have to try to understand how the exam writer thinks. So I will share some thoughts with you, but this is all available online. I'm not giving you any privy information, and I'm not charging any money for this. So that's really important. I don't think you need to pay a lot of money. Perseverance. So if you start today, you have to give yourself some time before you can take the Casper. It cannot happen overnight. And so you have to persevere through the practice. You have to practice daily. Mentors told me when I was going through MCAT practice, you have to practice every single day. It doesn't matter if you're working in a lab. It doesn't matter if you're taking a summer school course. You have to come home. You have to sit down. You have to get through the material. It's very important. But if you work together and if you share and collaborate, you can do a great job. And that's really, really useful. And so you become a mental athlete, right? Proficiency is to know yourself. When you go into an interview, you must go into it fully knowing your CV. That is not a question. Your resume has to be back of your hand, comfortable. You also have to know, what are your fears? What are your experiences? What have you seen? How have you gotten to this point? And have you introspected? So those of you who practice introspection will find that the next step in answering somebody's question about how do you work with people, if somebody were to call your colleagues and ask about you, what would you expect that they would say? These have to be flying out of your brain as fast as I'm speaking now. And I think it's important that you prepare yourself for these things. And the proficiency part of it takes time. So you have to give yourself enough time. And that's why the planning we talked about earlier comes in handy as well. Let's talk about some important communication skills. Now, I'm not going to go into the stuff that you already know and that everyone will tell you. What I want to talk about are specific communication skills. This is a commonly used way of communicating in medicine or in hospitals or in healthcare in general. This is called the SBAR method. The SBAR method. If I pick up the phone and I'm talking to the emergency doctor, this is the kind of method that he's going to tell me about so that I know what to do with a patient and how to do a scan or what to tell him after the scan as quickly as possible. So we don't have time to waste. All of this happens really fast when people are sick. So first, the situation. Hi, I've got a 55-year-old that just came in. He was in a car crash. The car is totaled. I'm worried about his pelvis. He is hypotensive, meaning he's not maintaining his blood pressure. Okay, now I have a very good idea. This person is an unstable patient. Background. What is the pertinent history? Oh, by the way, he's got, background diabetes. Okay, that's not really relevant in this particular scenario for somebody who's been in a car crash and might be hemorrhaging. Summarize the facts. He says, I've looked at him, he's unstable, he's not breathing well, we're gonna stabilize him, I'd like to get a CT scan. Okay, very good. So I know exactly what's happened. I know how he's gonna show up at the CT scanner, probably with a team. And then the recommendation. What is he gonna ask for? I'd like a CT scan as soon as possible, please. Can you prioritize him? He's not very well. Okay, so now I know exactly how to prioritize the scan. We get the scan done, I tell him the results at the scanner. So this is an example of SBAR. You can apply this in your own lives, in your own ways, and in your own preparation for some of these interviews. This is the SPIKES protocol. This is how you give information to a patient, but you can adapt it to other scenarios as well. The SPIKES protocol is you have to set up the interview. Now, obviously, in today's day and age, sometimes emergency rooms get full, but in an ideal scenario, you would have a private space to talk to the patient. So setting up the interview is setting up the space, the environment. Let's say somebody needs to get a diagnosis of cancer. You don't do it in the hallway. You don't bring them aside and say, by the way, you've got lung cancer. Let's get you some help. That is not the right way to do it. You set up the space, you have them sit down, you establish rapport, you assess the patient's perceptions. So part of this is, what do you think I might be telling you today? How do you feel? We've looked at your scans and we think there's something going on. Do you think you know what it is? You get their sense of what they think they might be, and you listen to them. Obtaining an invitation from the patient. Maybe they say, you know what, doc, cut to the chase, just tell me what it is. You respect that. And then knowledge and information transfer to the patient. You say, this is lung cancer, this is what we're gonna do, we're gonna help you out. You also have to be there and be empathetic. Do you have supports? Who brought you into the hospital today? Can I set something up with a counselor so that you could speak more about this? These are the details that you build into the spikes protocol. So I'll leave it up for a second. And if it's useful, I can send out a summary later on. What else is in your control? Now, some tips for you very specifically, okay? Learn some of these models and look some other ones up. So I put up SBAR, peer with 3 E's, read, care, and spikes. Look these up and find out what each stands for and how to integrate it into your practice. Actively listen and empathize. Learn how a body language makes a huge difference in how you listen to somebody's concerns. And if you do this in regular life and you respect one another, when you go to an interview scenario, you're not going to be doing it first, and you're not going to be doing it newly. You're going to be doing exactly what you practice in real life, and it makes it even easier. So you don't have to fake it, right? It's really important you learn how to listen, not just listen, but actively listen. So not thinking about your email, not thinking about the next patient, not thinking about what else you have to do that night with your family or some other argument you might have had, but just focusing on the patient in front of you. Then you have to empathize. Put yourself in their shoes. What is going on through their brains? I do this with even anti-vaxxers and anti-maskers. I don't just judge people. I think, okay, what drove them to making this decision, which I might not agree with at all, but let me just think about it through their lens. And is there a way for me to connect with them? Respond, don't react. And then some of these other things you can read for yourself, but body language matters. Learn how to review and summarize what somebody's saying. So you might say back to me, I heard you tell us about active listening and you said you should really empathize with somebody. Is that correct? That is regurgitating and repeating to me what I said to you so that we know that we're on the same page. And the last point is about LEAP. It's another acronym. LEAP means listen, empathize, agree, and partner. These are all ways in which we build our communication skill set, which is one of the CanMed's roles. So this is what I suggest for content. When you go into an MMI or Casper, you are given a prompt. Take that prompt, read it carefully, be in the present moment. What is the goal? If the prompt says, what is your opinion? And you don't give an opinion by the end of that answer, whether it's written or you're giving it in person, you've missed the boat. If the prompt is about, how do you think the next step should be taken? Well, you have to say, this is how I think the next step is. Answer the question that's asked. Restate the prompt if you need to. Take different perspectives. How are the different perspectives coming into it? So a perfect example is COVID-19. There is the political perspective. There is the societal perspective. There is the restaurant owner who's trying to run a business and pay for the bills at home. There are a lot of different perspectives. Your goal is to be neutral and look at all the perspectives so that you respect the different stakeholders. And that's what I've said here. Now let's talk about Casper. Casper is a computer-based assessment for sampling personal characteristics. It was around when I started medical school and I had to take it. It is about 90 minutes long and multiple sections. It's kind of like an MMI, but on the computer. And the funny thing is now with COVID-19, even the actual MMI might be on the computer. But you have very little time to finish the answers on Casper. So let me give you some tips. This is a situational judgment test. You can't really prepare for it beyond knowing some background information about yourself and how you would handle different things. You can read around material, but there's nothing to memorize. There's no physics formulas. So it's really important that when you go in, you have to be ready to put out your answers as quickly as possible. Spelling and grammar don't really matter, but clarity does matter. So please take the time to put out a clear answer. Concise answers, meaning ones that are not rambling on, are probably much better than rambly answers. Other problem with rambly answers, if you have 3 boxes to put and fill in, you're not going to make it to the third one if you're rambling still about the first one and you think you want to be thorough. You're going to lose points. You're going to essentially waste 2 entire boxes. You have to have clear progression of ideas. Today, I was reviewing an article for publication, and I'm one of the reviewers for Emergency Radiology, the journal. And I looked at the article and I said, I couldn't even get through the first paragraph. It made no sense to me because it was poorly written. It wasn't spell checked. It wasn't. Now, in this case, spelling and grammar don't matter, but your ideas have to come across clearly. So you have to take the time to practice the skill set. And one of the ways you can do it is just go Google Casper practice questions. And there's tons out there online. Take some of them, put them in a PowerPoint folder, randomize them, and try it with yourself, and have your partner or somebody else you're working with also do that for you. The content is very important. What is the strength of the argument? And here, I can't really help you in a short session, but the more you read, the more you think about ideas, the more you spend some time critically analyzing information, the better you'll be. And if you prep that for the MCAT, you will also find that's going to help you for Casper. The final thing is you have a tight timeline, 10 minutes to finish 3 questions. So you have to focus and get your thoughts typed quickly. One of the things that I used to talk about when I was going through this process, and I've done this so I can say this, as soon as the question pops up, you should be so hyper-focused on the task at hand that you start typing almost before you finish reading the question. Now, I wouldn't say don't finish reading it, but I do say that it's really important that you don't waste time. And don't overthink your answer. Just get it on the page, and you can always make small changes later. But if you get the words on the page, you will do yourself a lot of good. Having marked Casper on the other side, I will say that some people don't even make it to the 3rd box. Don't be that person. It wastes points, and you don't get beauty points for having a beautiful essay on answer 1 and then not filling out answer 2 or 3. So my suggested approach: have a quiet environment, have some water, have anything to help you stay calm, maybe a little bit of instrumental music or something, or whatever floats your boat. 3 deep, big breaths. Now I'm going to get you to do this with me. So all of you who are listening, I want you to just take a second, sit up straight and tall, close your eyes. I'm going to take a big, deep breath in, hold it in, deep breath out, hold it out. That's called box breathing. I've been doing that for years, and it's helped me tremendously to get through some of the materials and exams that I've done. If you practice that multiple times a day, by the time you hit the exam, you're going to be hitting it running. And I don't think you'll have any problems with being calm and collected. In fact, when I wrote the Royal College exam in the middle of the pandemic, I did the exact same thing. I was actually much more calm on the day of my exam writing it than I was waiting for the results to come out. That's a different story. Focus on the question and prompt. We talked about this. Begin answering as soon as you can. Quality matters more than the length. And don't hold back because you're worried about the quality of your answers. Just type it out. Now, let's take a prompt. Let's analyze it. I know I'm going to cut into some time later with my 3rd part of the presentation. That's okay. This prompt says, there is some evidence to suggest that the widespread use of certain wireless tablet devices in hospitals has led to significant improvements in patient satisfaction, as well as some small decreases in physician error. During the product launch of technologies such as the tablet, product shortages frequently occur, leaving some prospective customers empty-handed. Knowing that these technologies may benefit patients in hospital, some believe that hospitals should be given priority treatment to receive devices before being offered to the community at large. Here's your time limit, 5 minutes. First question: should the first come, first served consumer system for tablet product sales be altered such that hospital product orders should be fulfilled first? Second question: should companies be forced to discount their products when there is a societal benefits? Third question: what are some of the security issues related to the use of tablets in hospitals? So my recommendation to you, read all 3 questions really quickly, because I don't think it's a good idea to answer the 3rd question in the first question's answer box just because you didn't read it and you didn't know it was coming up. And if you take the first question, first come, first served consumer system. So when a tablet gets announced, let's take the iPad Air. iPad Air just got announced. Great. When it gets announced, should the hospitals have first dibs on buying the iPad Air? You have to substantiate. You have multiple stakeholders. You've got the hospital. You've got people who want to buy the iPad Air that are not part of the hospital. You've got the educational sector. So if the hospital gets it, do the schools get first dibs as well? How does that work? So all you have to do is start the answer such that you're balancing 3 perspectives. Just pick 3, it doesn't matter. Somebody else might say you have to balance Apple's non-compete perspective or whatever it is. It doesn't matter what the content is, as long as we can see clear progression of ideas and that you've taken some sense into the equation and answered the question. Second question, should companies be forced to discount their products when there's a societal benefit? Well, how do we look at that? If you force a company that is a private organization to discount a product, are you impinging on their rights as a private organization? If you do it for one company, do you do it for other companies? So if you do it for Apple, do you have to do it for Microsoft? These are questions that are arising in your mind, but as you're thinking of these things, put them down on paper. Put your thinking process down. Now, if you've done this in practice often enough, by the time you get to the exam, you're just going to think, you're going to type, think, type, think, type. And it's the same thing for the MMIs. Think, say, think, say. And then finally, what are some of the security issues related to the use of tablets in hospitals? And this is where you shine. This is where you talk about privacy, confidentiality, current security systems, hackers. What do they do? How do they protect the patient's information? The privacy and confidentiality are built into the Healthcare Act. And it's really important to protect these things. And if you've done a little bit of reading about the Healthcare Act, and you have to ask because that's part of your preparation, then answering this question becomes a lot easier. That's just one example. Let's talk briefly about MMIs, and then we'll take another quick break. 10 to 12 stations. I'm not going to go over the details. You can find this online. And then about the same time as Casper, maybe a little less. What is it for? So the MMI, when it used to be in person, was to be able to see a candidate, see how they handle stress, see how they handle situational questions, critical thinking questions, how they handle trained actors portraying patients, how do they communicate? Are they flustered? Are they not? Are they able to put their ideas together? Can they handle pressure? Do they say anything that sounds like a red flag? If you walk into the room and say, I'm sorry, you're a homosexual, I can't treat you, that's completely inappropriate, and that's going to be a red flag. Or if you say anything that sounds, not respectful of First Nations or the average person, the immigrants, we are a part of multicultural society. We have to respect one another. And so when you are applying for a profession such as being a physician, it comes with a great set of responsibilities, and you have to prepare yourself accordingly for these interviews because they're trying to weed out the people that do not fit in the system. So the areas that are covered are ethical decision-making. Again, I'm not telling you anything that's not available online, but I'm just putting it into a framework. Critical thinking, communication skills, and contemporary healthcare issues. Do some reading around this, and I'll give you some resources to read. Nobody's going to ask you specific knowledge. The fact that you don't know something does not count against you. And so therefore, be yourself and be honest. Don't try to make things up as you're going along. A lot of what I spoke about earlier with the Casper does apply here. So I'll let you read this for a second. This is my suggested approach for the MMI. Now, it doesn't matter if you're doing it in person one day or if because of COVID-19, these end up being online. You still have to dress your part. You have to hydrate. You have to sleep well, and you have to be ready. You take the 3 big deep breaths. If that works for you, great. Box breathing. It did work for me for every step of my life. Interact with everyone properly and professionally. This doesn't just mean the person that you are being interviewed by. This means the person that's emailing you that has nothing to do with your ranking or whatnot. Really important that you respect everyone along the process. Knock, introduce, give the sticker. This may not apply to you guys unless we get the vaccines next year. And read the prompt, reread it, be careful. Don't answer a different question and waste your time. Answer the question that's asked and answer it well. We're not going to go through that. I'm going to go to the suggested resources. Here are my suggestions for you. Doing Right by Hebert is a book that I found very useful. Review the programs and schools websites, which we talked about. Review the professional association websites. Look at their conduct, ethics, and values. What does the Ontario Medical Association have on its websites? Read the big reports, Romano report and Drummond report. Romano's from 2002, I think, and Drummond is from 2012. So these are already kind of older, but they're probably more recent reports on the healthcare system as a whole. And then look at recent health issues, physician-assisted suicide, refugee health, vaccinations, masking, privacy, two-tiered healthcare, etc. So it's a pacemaker for your heart. Plus, you can download apps for your liver, kidneys, lungs, and pancreas. So I'll take some questions now, And then we'll see how much time we have left for the last part.
So we got some questions in the chat. We can read those out for you.
Yeah, that'd be great.
So the first question we got is, would you recommend attempting the MCAT after only finishing first year of undergrad?
I'll give you a quick, easy response to this. The MCAT can be written literally at any point after your first year of undergrad. All that I think is necessary, and I don't think any particular undergrad year is going to help you do it better. Perhaps you do second year orgochem, third year, physics, whatever it is, and it might help for a small part of a section. But in my experience, I think it's more important that you prep for the MCAT over the span of your traditional 2 to 4 months. And you do so with some methodology. It doesn't matter if you pay $1,500 or if you do it by yourself. As long as you have a plan, I know people that have done any of these. After first year, my only take on this is I would suggest doing it sooner than later. Oftentimes, the average applicant needs to take it more than 2 times. That's just the average. It's probably different now. This was about 8 years ago. So the sooner you do it, the sooner you can give yourself some breathing room if you have to do it again. And the sooner you get a sense of how hard it is to prep, and so you can get over that obstacle.
What a phenomenal answer. So we have another question. And this person prefaced their question by saying that they think your dog is very cute. But their question is, what was your greatest challenge when it came to pursuing medicine specific to radiology, and how did you overcome this adversity?
Good question. I have a long answer, but I'm going to keep it short. The greatest challenge was self-doubt. Do I belong? Can I do it? I look around and I see these legends that have done it before me and side by side with me. And do I have what it takes? And that was before I got into medicine. After I got into medicine, I talk about this very freely with people, I had a form of imposter syndrome. I kind of kept saying, oh, you know what? They probably made a mistake. They're going to realize that I can't do this and they're going to kick me out. But I had to just fight that the whole way. In fact, I was taking my Royal College exam this year after 8 years of medical training, and I still felt like, nah, somebody made a mistake. I can't possibly be here. So I had to battle that every single day. And the way I did it was investing in myself, particularly the last couple of years. I really, truly invested in myself, which is mind, body, soul, and the way I interact with my environment, my family, my friends. There's a lot more I can talk about that. We'll get into that in my third piece of the talk, but that's my answer.
It's a really great answer. We can continue with the questions because there's a few more, or if you prefer to.
No, that's fine. Yeah, I want to prioritize the questions before I do my last piece.
Great. So the next question, the person is asking, how do you think the field of radiology is changing with artificial intelligence and other technological advancements?
That's a great question. And that's a question born from knowing your material and reading your stuff. So good on you for asking that. Radiology is a huge, vast field. It is not your typical field in the sense that a lot of the content changes every 5 years, 5 to 10 years. The technology we have to diagnose now with scanners and methodologies for how we call something a tumor, how big is it, what does it look like, or how we treat it, all of this changes from year to year. And it's constantly changing from head to toe. So you'll be looking at neurosurgical stuff and that'll change, neurology stuff will change. And all of a sudden you're looking at kidneys and GU stuff changes. So you have to keep up with that. AI. 3 years ago at the RSNA, which is the Radiology Society of North America, massive conference, huge. They only have it in Chicago every single year. They've had it there for over 100 years because Chicago has the only place that can house the number of people that come. It's a huge conference. What they said there was, stop training radiologists. We're not going to need them in 5 years. Well, they're out to lunch. Right now, you cannot get a machine to reliably diagnose many things. Papers have come out and AI has made a huge leap forwards, and there are algorithms and companies working on this, both small and large, including Google and Microsoft and other companies. But that doesn't take away from the fact that there is a lot of complexity. I think it's important for people to keep on top of their career choice. And if you're going through medical school, you should stay aware and you should know how to navigate a career choice if the career itself were to change. But all career paths have pros and cons. All of a sudden, surgeons that don't do emergency surgery have their surgeries canceled. So what does that mean? They can't make money. They can't help patients that need help. How many eye surgeries do you need in the middle of COVID when people are being locked down? If it's urgent, they'll get it done. But if it's elective, which is a lot of their practice, they can't. And I'm just generalizing. I'm not sort of pointing at any, but it's the same with radiology. If you cut down on emerge volumes, you're not going to have acute studies. If you cut down on cancer or mammography screening, you're not going to have the same volume of studies. So you're going to have people sitting around waiting for things. And that's a transition we're facing. So as long as you stay on top, you know your career motivations, you're ready to learn, and you realize that learning does not stop with your FRCPC or your certification, it continues for life, then you'll be in good hands. But if that's not the case and you want something to coast with for 30 years, I would almost argue medicine is not for you.
What a great answer. Another question we have here is, how much time should one set aside to adequately prepare for Casper?
That's a good question. Casper, I see Casper prep as a continuum towards the MMI. So Casper usually happens first, and then based on the results, you get filtered into a pool to do the MMI, and then you get filtered into a pool to be ranked. I think Casper prep should be anywhere from 4 weeks to 2 months. I mean, it's very dependent on the person, what they know or don't know about, how much they need to read. If they're completely foreign to healthcare and they decided yesterday that they want to apply to medicine, there's a lot to catch up on and read. And it's not science. I'm not talking about medicine, anatomy, physiology. I'm talking about healthcare system, how to interact with people, what are the laws, just general stuff. And you don't have to memorize these things. You just have to have a way of communicating yourself. And so I think about a month to 2 months.
Great, that's a really excellent answer. We have another question, which we are going to say to the end. It's a sort of longer question, and I'm in contact with the person right now. So you can
Wonderful.
Whenever you're ready.
Wonderful. Okay, well, all of you who have been with me so far, I'm looking at 21 participants. I'm going to make the last part worth your while. Get out your poll apps on your phone or websites, so whatever it is. I'm going to put up the link again, and then we're going to just do this last part, and we'll take some questions at the end, okay? Hopefully I'm making the best use of your time. Okay, so this last part is a talk I delivered, but slightly modified from the summer. So if anyone was attending the Circle conference, you might have heard me speak on this, but I don't know if there's a lot of overlap in our attendees, so we'll just go ahead. So this is about how to approach your self-development when you go through this process. The reason I want to touch on this is I don't think your value as a human being should be based on whether or not you get into medical school. I think that's a dangerous way to frame your goals and perspectives. And nor do the letters beside my name, and I'm going to put my standing desk down. Nor do the letters behind my name give me the value that I have. So your self-confidence should be high enough, and you should bring intrinsic value to your life. If you do that, you will be happy. But if you value your life based on your bank account, how many friends you have, how many likes you have on social media, or anything of that sort, which is external, happiness is going to be elusive. Okay, that's just my take. Happy to talk more about that, but we're going to cover some points here. So I want to share my inspirations and experiences. What did I do outside of all of this prep? While I was going through all of this stuff, while I was living my life, while I was building a family and going through residency at the same time, what else did I do? How did I invest in myself? I'd like to leave you guys feeling anew, with a new sense of energy and a new sense of enthusiasm for what's up ahead. And I want you to get a sense of how important introspection is, which is the ability to look at yourself from outside yourself and look for ways to improve. And I'd like to touch briefly on the importance of mindfulness and meditation. So this is not advice, because to advise would be to advise, and I don't want to do that. I'm going to share mistakes and lessons I learned. And I only want to share what I practice. So if I don't mention it here, I probably don't practice it. And if I do mention it here, I'm actively practicing it. I'm not perfect. This is my Twitter account. If you want to follow me, I tweet random stuff, mostly radiology. This is the poll. I want you guys to participate. It'll show up on the screen. So hopefully you will answer. So let's start with the first poll. What level of education are you at? And I'll give you about, let's count it down, 10 seconds. Now I realize you can't see this. Okay, I'll read out the answers to you, okay? So let's stop there. Undergraduate, we have 91%. Postgraduate professional degree, we have 9%. So that's wonderful. The end of education is character. This means a lot to me. I've been heavily influenced by the teachings of Sri Sathya Sai Baba. And that's because I've lived some of these teachings and they've brought me to where I am today. So if you do something that you've lived for years, like a marathon runner trains under trainers and runs marathons, you're inevitably going to think that it is a beautiful thing. What else is beautiful? The way that this quotation goes, end of education is character. So again, not the bank balance, not the degrees, not your title in society, but your good character. And if you prep with good character up front, then the rest of your life will just be the ability to live through that really well. So I think you have to see yourself from within and from outside. What I mean by this is, there is the external you. There is the you that you have created in this world, the version of you that gets updated every couple of years, maybe every month, and it changes. And your physical appearance changes, your interactions change, the way you hold yourself, how you talk, blah, blah, blah. But then there's the inner you, and the inner you is just the you that you know. It's deep inside, and it's the you that you go to sleep with, right? You close your eyes and it's there. That inner you, I think, is a you that you have to keep developing, despite having all these exams and all this coursework and all these goals on the material and worldly side. Simon Sinek is an excellent speaker. This is from a 2009 talk. I've borrowed his graphic, so I give him full credit here. He says, start with the why. Why do you exist? What is your purpose? What do you add to the world? We ask ourselves and our kids, what do you want to do when you grow up? Well, I am mindful that I don't want to ask my son that question. I want to ask, what do you want to add to the world when you grow up? How do you want to change the world when you grow up? And why do you want to do it? Then you layer it with the how. This is the sort of next layer. How do you achieve the why? So if the why is, I exist because I seek to be happy and be loving, then the how is, well, how do I translate that into my thoughts, words, and deeds, right? How do I actualize that through my actual concrete day-to-day choices? And then finally, the what. The what is the last thing. He says it better. I've adapted it. So please go check him out on TED videos, TED Talks. But this is a 2009 talk. So the next question, I want you to tell me in the next 10 seconds, who are you? Just type it in. Who are you? And I'm not going to give you any sort of leading responses. And I'll read this out to you. So you can't see it because it doesn't actually update in real time, unfortunately. So let's take another 5 seconds. 4, 3, 2, 1. And keep adding it so I can keep reading. So I see learner, I see student, lots of people said student. I see am, I love that. Who are you? Am, you just exist, that's beautiful. Musician, practicing, graduate, learner, passionate. This is how you see yourself. So that's wonderful. Now, the same way I'm asking you this question, you should ask this question every single day, at the beginning of the day and at the end of the day. What are the next? Tell me your company and I will tell you who you are. What do you surround yourself with as influences, both what you eat, what you smell, what you see, what you hear, what you touch, and how does that influence you? Okay, so think about that for a second. These are my influences. These are the people whose works I've read in the last little while. Eckhart Tolle, Tim Ferriss, James Clear, I'm going to touch on him in a second, Wayne Dyer, Neil Donald Walsh, Joe Dispenza, David Allen, Getting Things Done. These are my circle of mentors. And I probably met only one of them. The rest, I've read their books and works. So you see how you can create a mentorship circle without even having to meet somebody. So tip number one, introspection. And it's an art and it takes practice like anything else. This is the way I do it. Every day I ask myself, what did I learn today? And where am I headed? How did I learn it? So if I'm at work and I'm learning something, and it doesn't matter if I'm done my exam or not, I'm going to be learning. Then I say to myself, well, what is it that I learned? Okay, today I learned about how to search the pelvic cul-de-sac, which is a part of the pelvis, for endometriosis deposits. And I learned how to do that on MRI. Okay, great. But how did I learn it? Did I learn it from a person, from a book, from a website, from a course, from a textbook? And if so, can I replicate and improve the path to which I learned it? And if you're mindful about that, your next step in the learning process becomes easy. What am I thankful for? Every single day, I ask myself this question. And I answer it in the morning and I answer it at night. I'm thankful for many, many things. So I'll give you a little insight into my wacky brain. I think I go to sleep, but I actually die every night because I can't be yesterday. I can't be there, it's gone. And I can't be in the tomorrow, but I'm in the present moment right now. And I think if you relate to what I'm saying, you'll find that you're also in the present moment. I mean, you can't change what happened yesterday. You can't really go into tomorrow and predict what's going to happen. So then I'm thankful for being alive. I'm thankful for waking up. I'm thankful for the place over my head, this beautiful technology that allows me to share these ideas with you. I'm thankful for the breath that I can breathe because I don't have COVID-19 and I'm healthy. I'm thankful for the hands that allow me to make this presentation. I'm thankful for so many things. So oftentimes in life, we look for the big miracles. Oh man, I got into medical school. Oh my God, I got a nice car. Oh my God, it's so wonderful that I got to, I don't know, buy a new sweater. But what about the small miracles? Oh, I got to eat today. I mean, I got to breathe today. I didn't end up in the ICU. I got to say hi to my family today. These are the things that I think allow us to change our perspective so that the small miracles become more important than the big ones that we want. Who do I choose to be tomorrow? This is an important question. So while it's okay to think about the future, I think we have to think about it from the perspective of the present. How will I grow from today to be better tomorrow? One of my mentors at the graduation speech a couple of years ago said, he doesn't care about perfection. It doesn't matter how perfect you are. What matters is progression, meaning today to tomorrow, there is change and it's change oriented in the right direction, which is upwards, better, bigger, more broad-minded. In medicine, we call this reflective practice. So I'm going to tie it back. In November, in my first semester of medicine in 2012, I was asked to write reflective practice. I write down my thoughts and I process my thoughts. So I wrote this down. You can read it if you have the time, but I wrote this down and I randomly found it when I was putting together this talk. And it amazed me at how reading this now made me realize how I thought back then 8 years ago. For example, I said here, can I be an excellent scholar and great at patient care? Can I develop my medical knowledge as well as what it takes to be a great surgeon or radiologist? And I was thinking then, before even I knew I was going to apply to radiology. But reading back to this, I realized at the last line, I say, but alas, this too shall pass. And I remain convicted to doing the best I can while being myself. So reading this was powerful. The next year in 2013, I wrote more and I said, following some very trying times at home with my father's health and my mother having to make changes to her employment, I decided I needed to slow down and smell the roses. So I was reflecting then and I continue to do so. And it affected the way I looked at the world because then I processed these feelings on a daily basis as opposed to just letting them build up. Now, what do? Daily morning and nighttime gratitude. thankful for this, thankful for that. I just listed out everything, you know, my family, my bed, my pillow, the fact that my phone has charge left, everything. Choosing in the now and here, and balance, being in a state of equanimity, right? No matter what happens, the ups and downs will continue to come. No matter how big you're up today, tomorrow will have a down of some sort. And if you get used to that, if you think it's a sinusoidal function, it just goes up and down, you resort to stopping your stressing about it. You just stop and you say, let's be balanced. Let's stay in the middle. You've seen this slide before. I'm going to skip some of this stuff because I don't have the time to cover everything. And I'm going to go to the things that I think are most important. So I've put together some quotations here that I got from Timothy Ferriss's book. It's called Tribe of Mentors, Short Life Advice from the Best in the World. This is one of the more powerful ones for me. There's nothing that the busy man is less busy with than living. There's nothing harder to learn than to live. Matthew McConaughey, who was in Interstellar, which is one of my favorite movies, says, just keep living. He wrote that when he was 10 years old on a piece of paper. It's the 10th thing that he wrote that he wanted to do with his life. And he forgot that it was even the case. In his memoir, Green Lights, he speaks about this. Just keep living, right? Don't get so busy and so bogged down that you forget to smell the roses. I'm going to skip this because we don't have time, but maybe a future time. This is my motto. I have this actually on my top line of the CV. I even mentioned it in a real life work interview yesterday for a job that I'm applying for. I mentioned this because it's important to me. Change of work is rest. The human mind cannot multitask. It's been beaten. It's a myth. It cannot do it. You can't do more than one thing. So I can't be talking to all of you here and be checking my phone and responding to a message. Similarly, I can't be reporting a scan at work and also be on a call with my wife. It just doesn't work. But change of work is rest. So instead of saying, I need a break, I'm burnt out, you have to look at the way you can take going from work, coming home, playing with your kid, going from kid to sleep, going from sleep to a very early morning meeting, preparing for a side talk like this one. Each of these is a transition. And when you go from one thing to another, take a surge of breathing and put your newfound energy into it, meaning find the joy in doing something different, right? I break it up. So if I have a really difficult day working with really difficult people, how I approach it is, but it's only a day. Anything can be done for a day. If I have a week of call, and I got off a week of call last week, and I was on call every single day, and I worked probably 12 hours a day, and then the rest of the time I'm on call, I say to myself, well, okay, that's okay. Anything can be done for a week. You just get through it. So this kind of thinking gives you resilience so that you try to minimize burnout episodes. Atomic Habits. I highly recommend this book. And I think anyone who hasn't heard about it should pick it up and give it a read. It changed my life in the last couple of years. And I'm never too old or never too learned to ever stop learning about the simple things. All it did was teach me the power of a habit. It taught me that motivation and enthusiasm can take you so far. But if you have habits, you will never fail because that is an automatic process. If you want to learn more about that, read that book. One of the passages that I took from the book, this is jamesclear.com. He says the 3 R's of habits: reminder to trigger and initiate behavior, routine to make the behavior itself stick, and reward, the benefit at the end of it. He goes into it in much greater detail. So can I ask you, and I'm skipping some questions here, but can you guys put into the chat box, not chat box, the app, 3 worst habits? And you can just put in whatever because nobody's going to see your response except for me. And I don't know who's typing what. What are your 3 worst habits? Be honest with yourself. Yep, I saw that coming. First one out, procrastinating. First one. We all deal with it. Give you 5 more seconds. There's only one answer so far, procrastination. Okay, that's all right. Well, we have a winner here. Literally one single answer, and now a couple more being put in. Overthinking, eating bad, sleeping in, spending too much time on the phone. Yeah. Okay, so I have a secret for you guys. I'm guilty of all of those things too. Okay, every major massive professor of this and that, everyone's gone through this. Okay, the only difference is to what degree do you let these bad habits ruin your life? Okay, and if you can minimize the bad habits, you've overcome them. You can't eliminate them usually. Well, if it's smoking, you can eliminate that, but I highly encourage you to. But you can break up these bad habits. Okay. Now, I like this question. Let me hear your thoughts on this. What would you do if you were not afraid? If you were not afraid about what people would think, or what would you do? Let's take five seconds here. And I'll read out the answers to you. Okay. 5, 4, 3, 2, 1. Okay, got no responses. That's okay. Okay, this is what I would do if I was not afraid. I would first be, then I would do, then I would have. I got this from Conversations with God. It's a book written by Neil Donald Walsh. What it taught me is, oftentimes we say, I want this. I want some water. But the obstacles to I want water are that I'm saying I want it, meaning I am wanting of it, meaning I do not have it. We do this with happiness. We do this with money. We do this with many things in life. If you're first plentiful, if you define yourself as I have everything I need and I choose to be plentiful in my life, then you go out and you will live that into your daily reality. And then you will actually have the things that you feel plentiful about. There's a lot to decipher here. I will just leave that as a thought. Check it out in Conversations with God if you're interested. I will skip some of these things. This was a full hour talk, but we're not going to have time to get through it. I talked about cold showers at the time. Can you give me an example of when you failed? So let's do this one. I'll give you another 7 seconds. 6, 5, 4, 3, 2, 1. Keep it going. So I'm seeing some stuff. Failed a course, standard year, second year of program, GPA rejected. Yep, failed school year. Yep. We all think of school as failure, right? Yeah. There are other types of failures too, but I mean, I totally understand. The crowd here is intending to do well, and so everyone's worried about that. Okay, well, I'll show you my failures. My GPA plummeted in first year of university. I graduated with the highest average in my high school, grade 12. And I had a low GPA first year. I nearly failed second year organic chemistry. I got a 56% at UofT, St. George campus. Too bad. I wrote the MCAT twice. I applied to med school 3 times. I worked 2 summers at basic science labs, and I had 0 publications. I'm saying this because I want you to know that these are not the moments that define me. These are the moments that motivated me to see past the failure and learn something every single time. But I actually came across this online. Somebody actually created a failure resume. He created an entire resume for himself to catalog all the things he did that did not pan out. I think we should all do that a little bit, because it'll make us feel better that we all have failures. And these are just then, I've had failures since, and I will continue to have failures, projects that don't work. And it's totally fine, because we have to learn to realize that failures pave the path for success. And if you don't try, you failed right away. And I'm going to go into my final slide here, or one of my final slides. These are the books that changed my life the most in the last 5 to 10 years. Atomic Habits in the last couple of years. David Allen about 10 years ago. Tribe of Mentors about 3 or 4 years ago. Conversations with God definitely in the last couple of years. It changed my entire life, and the power of intention. Now, you might say, oh, this guy reads a lot of self-help. Who cares? It's help for myself. I need it, and I read it, and it makes me better. Don't worry about what other people think. Do what you got to do. Parting thoughts. Each day is a reset, ladies and gentlemen. Learn from yesterday and grow into today and grow into tomorrow. I advise I advise nothing. I share that I've done gratitude and meditation practice, and I think it helped me a lot. So you may find the same benefit. And I think the be, choose, have mentality has a lot of long-lasting repercussions for life. And that's me. Thank you so much. That's the end of my 3 parts. I took a long time, so I apologize. If you are still here and haven't left already, thank you for paying attention and giving me your time. Hopefully it was useful. And I will be happy to take any questions.
Thank you, Doctor, for such an insightful and well-prepared session. It brought forth such gems for those aspiring not only to become healthcare professionals, but professionals in general, I would say. Unfortunately, we've reached the end of your presentation, but as you mentioned, if anyone has any questions, you can do so using the chat box or the raise hand function.
We've got one question in the chat, which I'll read out. The question is, are there any fears or uncertainty that you face currently in your career, and how do you deal with them?
It's a great question. Okay, so here's the very honest answer. Yesterday, I did my first job interview for a full-time staff position. And in the interview, I was fully confident, I was prepared. And I've done this long enough that it was second nature. But I finished the interview and I sat by myself for a while. And I just thought about the idea of now being fully fledged and completely independent after my fellowship ends. But even before then, and the idea that I would do a report on a study, and we carry a lot of responsibility on our shoulders, and that it would go out into the world and effect change in a person's life makes me feel this small. So I think it's healthy to feel scared, and I think I'm going to feel that into really, really giving the best effort possible for my patients. So that's something that I will have to deal with as I transition.
Wow, that's very. It puts personally my mind at ease knowing that professionals such as yourself still feels these, feelings of fear and anxiety when it comes to interviews, exams, etc. So far, there's no other questions in the chat box, but I actually have a question. Sure. And that is, how has COVID impacted the field of radiology?
Oh, that's a great question. I was supposed to touch on that and I totally forgot. Okay, so some of the examples of COVID's effect on radiology are that when the initial lockdown happened, in the field of radiology, anything that's a screening test had to take a back seat. So the perfect examples are colonographies, not colonoscopies, which are done by general surgeons and GI guys. Colonographies, which are done by CT, which look for cancer, colon cancer. And when we find a colon cancer, we try to find it early. It'll take about 10 years for colon cancer to cause any significant effect most of the time. Mammography, which is breast screening, took a backseat. And these are all things that had to stop until we can figure out how to do it safely. And they took a back burner because that's not what we had to do to keep the hospitals open and free in case people with COVID came in and filled them up. Then that part got settled, and over the summer, slowly things picked up again, and we're doing screening. Now the second wave hit, and there is a section of elective procedures. So if a surgeon wants to operate on a cancer, there's a lot of imaging that goes with it. And if chemotherapy is to be done by a medical oncologist, a lot of imaging happens. Same thing with radiation therapy. So all of that is still done, but the volumes have taken a small dip. There's also a dip in the volumes of people going to the emergency department. So for any of you, if you're sick and you need help, you have to go. But what that means is it hit emergency medicine, it hit radiology, it hit surgical specialties, and it hit subspecialties of medicine, internal medicine, I mean, not just like general medicine, but internal medicine. Where you have not seen a dip as much is family medicine, still extremely busy, and they're the frontliners. They're keeping the system up. So it's really important for us to be ready so that when the backlog, all of the stuff that's now delayed and waiting for us comes and hits us, it's going to hit like a wave, and we have to be ready to help people out.
That's a really excellent answer. I think it's often probably vague and confusing how COVID has impacted the various fields of medicine. If there's no further questions, we will be concluding the session. Unfortunately, we are out of time. The Elevate Careers Conference team would like to thank Dr. Gopee-Ramanan for conducting his insightful and engaging session. Dr. Gopee-Ramanan is extremely modest, as you can all tell, despite his many years of education and his incredible expertise. For myself, and I'm sure everyone here attending, I think the session has been extremely informative. We have several comments in the chat, and we would really love to conduct another session with Dr. Gopee-Ramanan in the future, because we can all be sure that he has much more to offer, and hopefully he can elaborate on some of the topics he's talked about today.
And for
I
those
just want
who
to
want
say
to
thank
hear
you to
more,
everyone that, sorry.
Sorry.
Go ahead.
Oh, no, you can go for it.
No, I just wanted to say thank you to everyone that took the time to be here. It's not the most fun thing to do on a Saturday afternoon, but I can tell that everyone is passionate. They care about what they're doing, and you know, you are the future of medicine. So I hope to leave the impression that no obstacle is too large to climb. And please reach out, connect with people, ask questions. I make myself available as much as I can, and I want to thank Elevate Careers Conference for hosting me, and I look forward to future discussions.
It was definitely our pleasure. You know, I definitely had fun this Saturday morning, hearing all this great information. For those of you who are interested in hearing more, we are actually conducting another session next week on Saturday, December 5th at 1:30 p.m. with another great professional. He's currently a professor at the University of Guelph, and he was the chair of the biomedical sciences. Additionally, he was on the residency admission board for medical school in Toronto. He'll definitely be able to provide some great insight to aspiring doctors and those pursuing professional careers in general. So you definitely don't want to miss out on that session as well. Stay tuned for further details on our website and social media, and we have put the link to register for that session in the chat box. Hope to see you all next week.